Hi friends, this is fundus picture of one of a diabetic patient who is on insulin. When you look at this fundus picture, you can see some abnormal blood vessels on the optic disc, which are called as new vessels at disc, and also there are abnormal blood vessels away from the optic disc, which are called new vessels elsewhere. The presence of new vessels at disc or elsewhere are the features suggestive of proliferative diabetic retinopathy. You can see some blood vessels here. The smaller caliber blood vessels are arteries, whereas the slightly larger caliber and more dark in color are the retinal veins. This is the picture of the other eye, again showing pretty much similar features. That is, there are new vessels on the optic disc, as well as there are some new vessels elsewhere. There are some retinal hemorrhages around the optic disc. Again, these are the features suggestive of proliferative diabetic retinopathy. This is the fluorescein angiogram picture of a diabetic patient who had fluorescein angiogram, and this is showing some leakage from the blood vessels around the optic disc. These are the new vessels at disc. Fluorescein angiogram is one of the diagnostic tests for confirming neovascularization. If you compare the normal blood vessels and these abnormal blood vessels, the normal blood vessels don't leak the fluorescein whereas the new vessels at the disc, because they are abnormal, they tend to leak the dye profusely. This is how we differentiate the leaking blood vessels, the neovascularization, and collateral blood vessels which do not leak. You can see some black spots. These are the laser scars. Probably this gentleman had panretinal photocoagulation lasers previously for proliferative diabetic retinopathy. Presence of the neovascularization suggests, in spite of the laser treatment, the proliferative retinopathy is still active. This central dark area is the foveal vascular zone in the macula. This is again the fluorescein angiogram of the same patient a little bit later, showing the leakage becoming a little bit more profuse. You can see the blood vessel are becoming less distinct over a period of time. This is again the fluorescein angiogram of the same patient. A little bit later, you can see the blood vessels at the disc have become almost indistinct. This is suggestive of active neovascularization. You can see panretinal photocoagulation laser scar above and below the superotemporal blood vessels. You can see some leakage in the macular area suggestive of diabetic maculopathy. Hence, fluorescein angiogram is a very useful test to confirm neovascularization before deciding on treatment in patients where clinically it is not very obvious. Secondly, fluorescein angiogram also helps in assessing the macula to look for any macular ischemia or macular edema, which helps in deciding treatment. Thank you.